This presentation will review the DCLS COVID-19 sample submission form. The Department of General Services Division of Consolidated Laboratory Services, DCLS, is Virginia's public health and environmental laboratory. Public health laboratories in the United States play a vital role in identifying and responding to an emerging disease such as COVID-19. DCLS began testing for COVID-19 on February 29, 2020. This presentation will review the fields to be completed on the current DCLS COVID-19 sample submission form. Upon completion of this training, users will be able to accurately complete all necessary fields on the DCLS COVID-19 form to ensure data integrity. DCLS COVID-19 sample submission form, document number 34293, revision 3, was revised on July 31st, 2020. These revisions comply with the U.S. Department of Health and Human Services' new laboratory data reporting guidance for COVID-19 testing announced on June 4th, 2020. Data on the submission form is used by public health professionals to inform decision-making in their response to COVID-19. Accurate, complete, and legible data is essential to ensuring standardized reporting. Complete the form with data integrity in mind at all times. To submit a COVID-19 sample to DCLS for testing, utilize the current submission form, which can be located on the DCLS website using the link provided. Data integrity is the overall accuracy, completeness, and consistency of data throughout its entire life cycle. As we review the fields in the DCLS COVID-19 sample submission form that you will be completing, pay close attention to critical components that can break this cycle, such as data that is illegible, inaccurate, incomplete, containing conflicting information, or containing non-conventional data such as time, date, or acronyms. We will review an example together and discuss common data integrity issues. For this example, we will review completing a form on a sample collected during a scheduled community testing event in Richmond City with the Virginia Department of Health, or VDH. The patient was asymptomatic and attended the event by driving his vehicle through the pharmacy site. This is his first COVID test. He is not employed in a healthcare field, and he does not reside in a congregate care setting. The patient information section of the form is essential to ensure results are tied to the correct patient. The requirement to include demographic data like race, ethnicity, age, and sex will enable us to ensure that all groups have equitable access to testing and allow us to accurately determine the burden of infection on vulnerable groups. Complete this section of the form in entirety. In the first section, you will collect the patient last name, first name, and middle initial. No prefix is needed, but add any applicable suffixes such as junior or senior to the last name field. The patient date of birth provides their age. The format for completing dates on this form should be the conventional 2-digit month, 2-digit day, and 4-digit year. Select only one option for gender, male or female. Complete the patient address in entirety, including the applicable street, post office box or apartment number. The city, state, zip code, and county of residence are also needed. The patient may also be in a clinical setting where they have been assigned a medical record number or MRN, a patient ID, or unique client ID from VDH. Put any applicable numbers in the corresponding space on the form. Include the patient's race by referring to the 1997 standards from the U.S. Office of Management and Budget. Check the applicable box for ethnicity, which is either Hispanic Latino or non-Hispanic Latino. In our example, we have an Asian man who is not of Spanish origin. Include the patient phone number with the area code. Select the appropriate box for pregnancy status, either yes, no, or unknown. Outbreak data and contact tracing are based on information such as geographical locations, race, ethnicity, and pregnancy status. If there are inaccuracies or omissions, the data is incomplete. Be on the lookout for data integrity issues through simple omissions, such as missing the phone number area code, leaving off county of residence, leaving off any part of the information, such as designating an address as street or road, or any writing that is not legible so it cannot be interpreted, will also result in an issue with data integrity. The next section of the form is asking for submitter information. The submitter is the facility that will receive the test results. For example, a health department or congregate care facility. It is not the same address as the location where a community testing event, such as a drive-through clinic, took place, unless that is the facility authorized to receive the results. Ensure the facility that is authorized to receive the results is the only one listed here. Similar to patient data, ensure the complete and accurate address for the submitting facility is entered so that test results can be reported back to the submitter in a timely manner. Include the facility name, the address with city, state, and zip code. Provide the submitter phone and fax number, including the area code. The phone number is essential to reach the submitter in case any discrepancies or issues need to be resolved. The fax number and the mailing address may be utilized to send hard copies of completed reports to the submitter. The attending clinician contact information should also be included under the submitter section. Provide the clinician name, phone number with area code, and the zip code for the clinician workplace. Lastly, provide the information for the public health department contact, including the name and phone number with area code. Common data integrity issues come from an incorrect facility listed, conflicting submitter information provided, or incomplete information. In the patient medical history section of the form, there are 11 separate fields to complete. Most simply require the use of checkboxes to select the applicable information. We will look at each one in detail. The first section from medical history asks what disease is suspected. This helps narrow the scope of testing. As this form is specific to COVID-19 sample submissions, the disease suspected field is already filled in with COVID-19. No further information is needed here. The reason for test request indicates why the patient is receiving a COVID-19 test. You should select only one option from the available check boxes. The COVID-19 contact suspected carrier reason generally comes from contact tracing data where a known or suspected exposure has occurred, such as attendance at a large gathering where several participants were diagnosed with COVID. The surveillance option would apply to situations such as community testing events and point prevalence surveys. If the test is specifically for diagnosis, it typically will be ordered by a clinician and based upon symptoms or other relevant data. The clearance release option is used when the patient must have a negative result in order to return to work, move from one facility to another, or other similar circumstances. The option for VDH, reportable disease compliance, will be selected if the patient has a disease that is found on the Virginia Reportable Disease List. The other option should be used sparingly and only if no other category applies. In this example, our patient attended a drive-through testing event, which is categorized as surveillance. In the next section, select only one option to identify if this is the first time the patient has been tested for COVID. Yes, no, or unknown. Select unknown if that information is not available. In our example, this is the first test for our patient. The next two questions ask whether or not the patient has been hospitalized or has been in intensive care unit or ICU. Select from the options yes, no, or unknown. This section of the form collects data around the patient employment, residency, signs, and symptoms. The Employed in Health question. This question is to assess if the patient works in a part of critical infrastructure in a healthcare setting. Select only one option, yes, no, or unknown. Note that this information should not conflict with the response given under patient role found further down the form as it relates to an outbreak. For example, if you select no here, you should not select healthcare worker under patient role, as this is conflicting data. This section asks if the patient resides in a congregate care setting, which is defined as nursing homes, residential care for people with intellectual and developmental disabilities, psychiatric treatment facilities, group homes, board and care homes, homeless shelter, foster care, or other setting. Select only one option, yes, no, or unknown. In our example, the patient does not live in congregate care. Is the patient symptomatic, as defined by the Centers for Disease Control and Prevention, or CDC? Select only one option as yes, no, or unknown. If you select no, then the signs or symptoms section must read asymptomatic, which means the patient is without symptoms and nothing further should be checked in any of these sections. For our example, the patient did not have any symptoms, so we select no for symptomatic, and under signs and symptoms, we select asymptomatic or without symptoms. However, if the patient does have symptoms, then provide the date of symptom onset using the proper format. Do not select asymptomatic, as this is conflicting information. Select all symptoms that do apply, but do not provide symptoms in the other section that are already accounted for in the checkboxes. For example, if the patient is experiencing nausea and diarrhea, you do not need to add a comment to other, such as upset stomach. An outbreak occurs within a limited geographic area where there is an increase, often sudden, in the number of cases of a disease above what is normally expected within that population in that area. A case definition includes criteria for person, place, time, and clinical features. These should be specific to the outbreak under investigation. If applicable, VDH determines case criteria and designates an outbreak number, which would be entered on the form. COVID testing may be conducted at a variety of locations by different providers. The section for site event location refers to testing sites such as community testing events, site-specific events, and VDH point prevalence surveys. If applicable, the testing event location should be entered on the form in a consistent manner. This information ties the sample to the event, so it should be concise and consistent, such as the location name being listed the same way on all forms collected that event. Information on the patient role is collected as it relates to a designated outbreak or testing event. For example, if the event is a point prevalence survey at a long-term care facility and the patient is a resident of the facility. If the patient is not part of a designated outbreak or specific testing event, then no information is necessary, but you can provide the data if it is available. Avoid writing additional roles in the other space unless it is specifically applicable to the outbreak information. Data integrity issues stem from information on a form that is inconsistent, uses non-conventional abbreviations or acronyms, or provides extraneous details. For example, several variations of the testing event location provided on separate forms can make it difficult to link all tests to that specific event. Only provide the information requested in the designated space and ensure that it is concise, legible, and consistent. For specimen collection information, enter the date collected using the appropriate format. Provide the sample time of collection in military time. Keep in mind, military time does not use the AM or PM designations. Instead, it refers to a 24-hour clock where the hours of the day are sequential from 0 to 23. For example, if you are designating 3 p.m., that is 12 hours plus 3 additional hours. So in military time, it is 1500. If you are designating 2:45 p.m., that is 12 hours plus 2 additional hours and 45 minutes, or 14:45. For specimen source, select the applicable source and be sure to select only one, keeping in mind what each source means. For example, BAL stands for bronchoalveolar lavage, which is a medical procedure that introduces fluid to the lungs and then removes the fluid for examination. An NP swab, or nasopharyngeal swab, is the preferred source. The final portion of the form is an open comment box for essential sample submission information only. Complete the additional information section only if it is necessary to provide details that could not otherwise be documented on the form. Avoid extraneous information, including names of potential exposure contacts, travel history, etc., which would be investigated by an epidemiologist with the Virginia Department of Health. This information can add confusion when it is included unnecessarily on a form. Avoid duplicate information that is covered elsewhere, such as symptoms or the location of a testing event. Ensure that that information is captured appropriately in the applicable space on the form. A risk of conflicting information arises if the same data is captured in more than one location. The box on the right is for internal use only by the DCLS state lab. Please do not put any information in this space. Once you have completed the sample submission form, review the form for data integrity issues. In addition to being comprehensive, the data captured and recorded on the submission form must be accurate and legible. The form should be free from errors and omissions so that all sections are complete as they apply. Does the form contain only the requested information, or is there extraneous detail such as potential contact names, travel history, or duplicate symptoms? With the exception of the signs and symptoms section, you should select only one option, if applicable, in each checkbox area. Do not complete the other and additional information fields unless the existing checkboxes and fields do not apply. Once you have completed the sample submission form, review the form for data integrity issues. Ask yourself, is the form in a manner that avoids conventional abbreviations or acronyms? It should have only conventional abbreviations. It should also only contain military time. Laboratory data serves not only as important information to support decision-making related to public health response activities, but also as a critical piece to better understanding the impact on socially vulnerable populations. Laboratory testing data, in conjunction with case reports and other data, also provide vital guidance for mitigation and control activities. If you follow these processes, you will be able to accurately complete all necessary fields on the form to ensure data integrity. And remember, you are essential to the response. High-quality data is at the core of any effective public health response, and standardized, comprehensive reporting of testing information will give our public health experts better data to guide decisions at all levels throughout the crisis. If you have any questions or concerns, please contact the Division of Consolidated Laboratory Services 24/7 at 804-335-4617. Thank you for your support in this pandemic response.